Medicine has greatly evolved from superstitious practices to science-based treatments to the use of artificial intelligence today, which will undoubtedly revolutionize the field further. While AI's possible future role in medicine may seem daunting, it definitely has the potential to make treating patients safer, more efficient, and cheaper. In the early days, medical practices such as bloodletting, trepanation, and mercury rubs were almost entirely superstitious practices that often harmed the patient rather than help them. In the 1880s, the medical field's acknowledgement of the germ theory published by Louis Pasteur led to the realization that the superstitious medical practices being used at the time were unsanitary and even increased the chance of death. By the early 2000s, AI was developed, reaching a major milestone in machine learning. Today, with advancements in AI, the potential for precision and efficiency will change medicine as we know it today. This paper explores the historical context of medicine's development and examines whether or not AI can be beneficial in healthcare and the ethical considerations that surround its integration. Historically, medical cures were based on superstitions that were often deadly. For example, bloodletting, a practice that involved draining the blood from a patient to either treat or prevent illnesses, was commonly used. It did neither. Another example was trepanation, which was the drilling of holes into the skull to release supposed evil spirits. Mercury rubs, another practice, frequently poisoned patients instead of curing them. The publication and acknowledgement of Louis Pasteur's germ theory in the 19th century led the study of medicine into the field of science. This milestone in history laid the foundation for modern medical sciences and is leading the way for the integration of AI into healthcare. It is already clear how useful AI can be to medicine due to numerous studies already performed that involved AI in different aspects of medicine. According to the Delphi study on emergency medicine, AI systems prioritize care by analyzing patient data in real time. This ensures that the patient gets attention all the time, even when the doctor is not present, which could save patients' lives. This is of sudden medical emergencies. Another study from the University of Wisconsin-Eau Claire explains how AI-guided interpretation of electrocardiograms, ECGs, is not only improving the accuracy of diagnostics, but also speeding up the process compared to if they were completed by human practitioners. For example, AI can be used to simplify medical patient reports from very long and complex into short and just saying the vital information needed. This will give practitioners more vital time needed to take care of patients. Additionally, according to Luis Pinto Coelho, who published an in-depth article using online databases and research papers on how AI is being used in medical imaging, AI is useful in a multitude of ways, including improving the accuracy and efficiency of medical image analysis, speeding up the interpretation of complex images, but also improving early detection of disease, and facilitating personalized treatment plans, thereby optimizing healthcare delivery. AI being able to analyze ECGs accurately shows its potential to not only enhance diagnostic precision, but also reduce human error and make the medical field move faster. This is even more important in cardiac care, where early detection of abnormalities can mean the difference between life and death. Similarly, in critical areas like emergency rooms, AI can be used to analyze patients' symptoms, which can lead to quicker and improved evaluations and ultimately improve health outcomes. Additionally, if a hospital is overworked, AI can help alleviate some of the burden on healthcare professionals. According to Julian N. Acosta for writing medical reports, AI-assisted workflows significantly reduced average reporting time from 573 to 435 seconds, p equals 0.003, without a statistically significant difference and clinically significant errors between workflows. This goes to show that AI is especially important to reduce time for mundane tasks that doctors have to do, such as writing medical reports. Despite all of the benefits, AI is unable to provide a 100% human feel that patients seem to enjoy in the medical field. This means that while AI can be used for fields like pattern recognition, data analysis, or keeping a live eye on patients to make sure their health is stable, it cannot perform certain preferred actions. This means that in the future, AI should complement rather than replace human practitioners. While the benefits and the potential benefits of AI are clear, there are ethical concerns in the medical community. One major ethical question brought up is whether or not AI can be biased. According to the National Library of Medicine, algorithms trained on incomplete or biased data sets can perpetuate inequalities in healthcare. Since AI is a trained system, drawing data from mostly one demographic may cause it to not provide accurate diagnostics for other demographics. A second major ethical concern is patient confidentiality and how it is stored, shared, and protected. Safeguards must be in a place so that patient data is not compromised. Lastly, where does accountability lie? For instance, if an AI system makes a mistake, who should be made responsible? These ethical questions need to be stated to make sure that AI's use in the medical field follows rigorous regulation and transparency. While many people may not trust AI and their judgments, studies have revealed that in most cases, AI is either on the same level of accuracy or even higher than that of doctors. According to Jennifer Bresnick, only 42% of providers globally and a mere 26% in the United States believe that AI can be trusted in its current form. However, according to Artificial Intelligence in Healthcare, Perception and Reality, it demonstrated a sensitivity of 86.4% and a specificity of 87.5%. In contrast, the trained nephrologist had a mean number of correct predictions of 69.4%, a mean sensitivity of 72%, and a mean specificity of 66%. Thus, while most people do not trust AI's judgment, AI has proven to have better accuracy than doctors. As a result, it is best to combine the two in order to not only appease people who worry about AI, but also maintain the high accuracy that AI displays. Additionally, while some say that AI doesn't get enough training, according to Luis, medical AI is exposed to over 59,000 indexed and curated images from over 12,000 patients. By using AI, medicine can become more accurate, efficient, and accessible, making it more sustainable. Its applications from ECG interpretation to emergency room triage highlight its ability to enhance healthcare delivery. However, it is important to consider the ethical challenges of AI, which should be pointed out and debated with collaborations between technologists, medical professionals, and policymakers. If the medical community can harness AI's full potential, then patient outcomes will revolutionize the field of medicine. The US healthcare system is very strong compared to a lot of other countries, but has its drawbacks that makes it rank last compared to 10 other high-income countries, the countries listed according to the Commonwealth Fund. This video will go into depth of the strengths and weaknesses of the healthcare system in the United States, as well as what we can do to improve it, according to world-class innovation, but at what cost? A brief examination of the American healthcare system by Spencer Delfino. The United States has some of the best trained physicians and medical technologies globally, but numerous reasons make them not as efficient as in other countries nor effective. Additionally, the United States likes to continually advance its technologies, as cutting-edge technologies are one of the hallmarks of the American system. An example of this advanced technology is the technology that the Mayo Clinic has developed over the past few years. According to 10 pioneering studies from Mayo Clinic Center for Individualized Medicine in 2024 by Susan Murphy, in a significant advancement for rare disease research, Mayo Clinic scientists developed a semi-automated system known as ReNu to rapidly reanalyze unresolved rare disease cases. While America has the potential to have a very strong healthcare system, it is unable to currently because of numerous limitations that lead to multiple inefficiencies in the system. For example, average life expectancy is very low compared to the other high-income countries. The numbers show that the United States is approximately around 77.5 years, while other countries tend to average around 82.2 years, which is a 4.7-year negative difference. Despite the average life expectancy being so low compared to other countries, the United States spends a much higher percentage of its GDP on healthcare compared to the other countries. In 2022, the United States used 18.3% of its GDP on healthcare than the 12% that the other high-income countries used. Additionally, the Affordable Care Act, ACA, which was implemented to help more United States citizens be covered by healthcare insurance and make it more affordable, still 26 million Americans remain uninsured. These uninsured citizens contribute to higher mortality rates due to having to skip medical tests, treatments, or medication. Citizens could be uninsured because of the high cost of healthcare. The ACA sets a maximum annual out-of-pocket limit of $9,450 for individuals and $18,900 for families. Despite this, 40% of Americans spend over $1,000 annually on out-of-pocket healthcare costs. It has also been noted that the healthcare system is very overburdened and expensive. A reason that could be the case is because many American citizens tend to go to emergency rooms for conditions that could be treated by a primary care physician. According to Emergency Department versus Primary Care Use, A Patient Perspective by Natasha Wu, US EDs see an estimated 144 million visits a year, totaling $76 billion, and 1 in 5 adults visit the ED at least once per year. Point 2. Many of these visits include non-urgent ailments that could easily be treated at the primary care office. Most importantly, unlike in other countries like New Zealand, primary care physicians in the United States are not well promoted or compensated for their extra hours, thus increasing patient reliance on emergency rooms. As a result, this increases patient stress and thus makes outcomes worse. So what can we do to improve these results? There are multiple ways we can do so, including increasing access to primary care services and incentivize their use. Expanding Medicaid and private insurance subsidies to reduce the uninsured rate, simplify administrative processes to lower costs and reduce patient and doctor burdens, promote models that provide after-hour primary care to prevent emergency room overuse, and lastly, address out-of-pocket expenses to ease the financial strain on patients. This structure will highlight the strengths, challenges, and actionable solutions for the U.S. healthcare system.
In 2027, Samantha Parker, a single mother of 2 small children, injured her back and knee when she slipped on black ice on her way to work. She decided the injuries were minor enough that she continued on her way to work. However, the next morning, she found herself in excruciating pain. She called her boss to let him know that she couldn't go to work due to her injuries, despite knowing that she had already used up her sick days.
I'm sorry to hear that, but as you know, you already have used your sick days this year. Unfortunately, I will have to dock your pay.
Desperate, Samantha's friend took her to an urgent care center.
Good morning, Samantha. I heard that you slipped on black ice and feel pain in your back. I need your insurance details before I diagnose you. Could you provide that information for me?
Here are my cards. Will this take long? I can't afford to miss more work.
Dr. Mark called the insurance company, reaching an agent working remotely, someone without medical training, following a rigid script.
Dr. Mark, the policy requires a 7-day pre-approval for such treatments.
7 days? Could you lessen that time at all? She's in a lot of pain.
I'm sorry, but we can't do that because our policy is very strict.
Samantha, without immediate approval, I can only recommend over-the-counter pain relievers and rest.
After 2 days of relentless pain and lost wages, Samantha learned of Dr. Jack, a physician utilizing an AI-driven diagnostic tool.
Samantha, our AI system helps with both diagnostics and insurance approvals. Let's assess your condition.
The AI rapidly processed her symptoms, cross-referencing millions of medical cases and imaging data, diagnosing a slipped disc within seconds. More importantly, because the AI system provided precise, well-documented input to the insurance company, it secured immediate approval for treatment, something that had taken Dr. Mark over a week to process.
Dr. Jack, the AI's detailed report clarifies the necessity. Approval granted.
Thrilled, Samantha started physical therapy immediately. Within a week, her pain had subsided and she was back at work. Days later, Dr. Mark received the insurance approval, only to learn that AI had already solved the problem.
AI accomplished what traditional methods couldn't. Maybe I need to rethink my stance.
A month later, Dr. Mark suffered a sudden collapse at work. Doctors struggled to diagnose him. Desperate, he called Dr. Jack. The AI scanned his medical history and symptoms and pinpointed a rare neurological condition, one that had gone undetected by human doctors. A minimally invasive robotic surgery, performed under AI guidance, restored him to full health within a week.
AI doesn't replace us. It makes us better.
The key is ensuring reliable input. Without it, AI is just as flawed as a bad diagnosis. But with the right data, AI can transform medicine.
From then on, Dr. Mark became an advocate for AI in healthcare, not as a replacement for doctors, but as a comprehensive tool that improves timeliness, fairness, and access to care.